Okay, so welcome everybody. Welcome to this session. So welcome everybody here in Chabad who's physically here, and welcome everybody online. And this is also going to be recorded for YouTube. So this is really a bit of a follow-on from a session that we did, maybe 4 months ago, a few months ago, which was on medicine and ethics. And I think that was an interesting and an interactive session which brought up some considerations in some grey areas of medicine. So one of the things about medicine is that, and life, is that there are grey areas. There are areas where it's not clearly A, B, and C. There are some areas where the management is A, B, and C. And I thought that this would be an interesting area. Another interesting area to look into, because there are situations when the answers are not clear-cut. And when we have like a forum like this and a place where we can explore together, then we learn together. So as well as hopefully you guys being engaged and learning, I'm also learning from a session like this. So the thing is, so I'm going to go on to the next slide. Okay, so let's go. Okay, so the aim of the session is to explore how medicine sometimes helps. Well, I think medicine can often help with many things. So I would say to look at those situations when medicine, and I think we're looking in the medicine that we're used to, certainly the medicine that I'm used to in the UK, so I'm a GP in the UK, but also I think in the mainstream medicine that we're used to in South Africa is kind of Western style medicine with quite a lot of medication where that's required. So that can be extremely helpful for a number of conditions. But I'm going to propose that it overreaches its remit. So there are several times when medicine, when something is treated with medicine, when that isn't necessarily helpful and can even be possibly a little bit not supportive of the person and possibly even a little bit harmful in that way. But that's for us to explore together. And there are no, well, I mean, sometimes there are rights and wrongs, but it's an exploration together. So does this sound like an interesting area to explore? Okay. And so let's go on to so we'll move on to the next slide. Okay, so, does this ring a bell for people? Okay, so that's good. Right, okay, so what do we think medicine, like Western medicine, is particularly good at treating? So let's have some thoughts on this. So the medicine that we're used to, what are situations where we really would like some Western medicine, some medication, some whatever is offered? So when you're in pain, so if you've got pain, then painkiller medications, absolutely, to manage those symptoms can be really helpful, but there can be other things also that can be helpful to help manage pain, like things like appropriate exercise and taking weight off the area, if that can contribute. But certainly when you're in pain, yes. Okay, so for pain, so something like a hot bath, absolutely. So those are other things. But we're thinking about conventional medicine.
Hypertension?
Yeah, so high blood pressure. Okay, so if you've got an ongoing so-called chronic medical condition, as in it doesn't just happen one day and go away, if you've got an ongoing medical condition, then sometimes, in many cases, medication can be really helpful. And if your blood pressure is above a certain level, you would probably want to be on medication. And there have been some very effective blood pressure medications that have been developed over the last 50, 60, 70 years, that kind of thing. So kind of ongoing, so kind of so-called chronic conditions, absolutely. So high blood pressure is one of them. What other examples could there be? High cholesterol. So if you have a cholesterol above a certain level, you would probably want to consider medication for it. What other kinds of things of chronic conditions? Yeah. Yeah, diabetes. So if you've got diabetes and your sugar's above a certain level, then there's a lot of evidence that medication is. So you also want lifestyle, but medication to help that. Absolutely. So in these kind of situations, we'd be a bit scared if we didn't have medication. So if you've got really high blood pressure and you weren't having medication for it, it would certainly get me in the gut. I'd be worried about that. We'd be kind of worried about that. If your sugar is sky high and you're not on medication for it, that would also be a worry because of the damage. So what other kind of ongoing conditions would we really want medication for? Yeah, so headaches, so pain, so that's the whole area of pains, but things like other, a whole list of conditions, but something like if you've got like an endocrine, a hormonal condition, and the gland is underproducing the hormone, then you would want replacement of the hormone. So something like thyroid disease, if you're hypothyroid, it's difficult to manage that, or it's really helpful to have medication for that. So we've got so-called chronic, don't really like the term chronic, but ongoing medical conditions. That's certainly, medication is really helpful. So what other kind of categories of conditions is medication really helpful for? So so cancer, it can be, so depending on what it is, but absolutely chemotherapy for many types of cancers, and it's revolutionized the treatment of certain types of cancers, which some of them weren't treatable before, but now with chemotherapy have extremely good survival rates and prognostic rates. So absolutely cancers. There are a couple of kind of mainstream categories that I'm thinking of that you would want medication for. Shall I give you a clue? Yes. Okay. All right. So if you're peeing a lot, if you're passing urine a lot and it's burning, well, it could be prostate, but the whole, and you've got a temperature. If you've got a temperature, infections, absolutely infections. So particularly bacterial infections. So I think, so correct me if I'm wrong, but I think the first antibiotic was, well, penicillin was discovered. I'm not sure if it was absolutely the first one, but that was discovered only in the 1940s. So, humanity, there's been a big advent in medicine in terms of antibiotics. So definitely, you would definitely want antibiotics for a good going bacterial infection. So there are all kinds of bacterial infections, but things like urine infections, big chest infections, pneumonia, you want antibiotics for that. Big sinus infection, antibiotics. Throat, tonsillitis, antibiotics, all kinds of things you'd want antibiotics for. So bacterial infections, but also other infections, like other organisms that cause infections, like fungal infections. HIV, what kind of organism is that? Virus. It's a virus. So some antiviral medications. So definitely, they've made major advents in medicine. Vaccinations, absolutely, has transformed the landscape of infectious disease. What was that? Yeah, so skin cancers, that's a type of cancer, and then you would have, so cancer as a category, another big category, two other big categories.
I wanted to know about cognitive impairment.
Okay, so what do we call that? We'll just put that aside for now, but we'll have that in mind. So two big categories. Okay, so one is, I think, emergencies. So if you've got trauma emergency situations, you'd want some good, you wouldn't really want just meditation if you've had a God forbid, you know, a big accident or something like that. So of course, emergency trauma situations, all of that, there's a whole gamut of medicine that's been transformational in the outcomes. And then another big category, so it's not medication so much, but it is, no, it's in conventional medicine, it's not medication. Certain group of specialists, what do they do? And well, psychoanalysis is not yet, so that's important. Okay, scalpel, surgery. So you have certain conditions you'd want surgery for that. If you've got appendicitis, you'd want your appendix out. You know, if you've got big going inflammation of your gallbladder with gallstones, you'd want your gallstones taken out. You know. Yeah, of course. So if you've got, you know, big bone-on-bone osteoarthritis, you know, it can be really helpful to have. So surgery, that's made a big difference. Well, so homeopathy is a part of the holistic of the whole in terms of what can treat the patient. So I was just thinking kind of specifically down the conventional medical paradigm just for this part in terms of what medicine's particularly helpful for. So we've kind of got an idea. Yeah.
My brother in America gets people like this together to speak, talk, do all this kind of things.
Okay.
And he says that's the best medicine is to go and talk to people.
Yeah.
Be involved with people.
Get involved with, so we're going to come on, we're definitely going to come on to that. So that's a really good point about meeting with other people and socializing with other people. So those are kind of the categories. That's not an exhaustive list of where conventional Western medicine can be is very helpful. Okay, so we don't want to be doing really without, be cautious about doing without medicine, those medications or medicine in those kind of situations. Okay, so I'm going to just go, okay, so however, okay, so that's, we've talked about that. So this is some of the paradox or the ambiguity now, and the potential reach of medicine potentially into areas where there are other things that will be helpful. So there are many models of what we need as human beings for our well-being, and one of them, and you've mentioned one of them in terms of socializing or relationships with other people, community. So I've just chosen this guy just as an example, and you'll know other ones that very likely that fit for you in your life. So Martin Seligman, has anybody heard of him? Yeah. So he's an American psychologist, and he worked with a lot of people, including veterans in the States, and he's worked with over 800,000 people, and using his techniques. But he had a model called, which the acronym was 𝗪𝗲, of well-being, and these were things that were required for well-being in life. And there are many, this is not exhaustive, there are many other models, but I quite like it as a model. So this includes, okay, so we've got positive emotion. Okay, so cultivating feelings like joy, gratitude, contentment, and hope to improve mental well-being. Okay, so any ideas? How do people here, what ideas do people have about cultivating feelings like joy and gratitude and contentment? What helps you to do that? Because that's important. Sorry?
Come to Chabad longevity.
Come to Chabad longevity. Does that resonate with other people? Yeah. And do you feel different when you do that?
Well, people tell me they like coming here. It's
Yeah.
a social environment.
Yeah. And so does that help you to feel a bit better and to feel some of those feelings? Okay, so there's something about the community, so that can help people. And any other ideas, like individually, what helps you to feel? Yes.
My grandchild
Your grandchild. Your grandchild. Okay. So, and anything particularly about your grandchild, or just your grandchild? Yeah, of course. Yeah.
He's not two yet.
Yeah.
He takes control of where he is. He's aware.
He's aware, so he's evolving.
Doctor, can you repeat what they said?
Yeah, yeah. And tell me your name actually when you, Shirley. So Shirley was saying, a thing, more than a thing, a person who brings her joy is her grandchild. So he's not yet two, but he's now he's a person. He's taking control and he's aware of his environment and his surroundings. There's something about his evolving and his development. So that's bringing you joy. And any other examples? What brings you exercise? So what exercise do you like doing?
Running marathon.
You do what?
Run marathon.
Do you? Okay. And then when you run so marathons, so I think I should say at this point, marathons are not necessary for everybody here. But when you run marathons, what do you feel?
Happiness, joy.
You feel happiness. So there is an association certainly with exercise and feeling. And is there another example, something that brings you?
Food. Won't use your like food.
Food. Any food in particular?
Any food.
Any food. Okay, but that's important. So that's, you get doing aqua. You like, and how do you feel when you do 6 days a week, and that brings you some of that feeling? Okay, so
Attitude of gratitude.
attitude of gratitude. So how do you cultivate an attitude of gratitude?
You get up in the morning, you open the curtains, and you see the sun is actually shining, and the blossoms are out.
So that then has you connected. So does that resonate with other people? That attitude. Okay, so so positive emotion. So that's important. That makes a difference for us as humans. Engagement. So Seligman talks about being in the flow, like an activity or a pastime or a hobby. So you kind of lose yourself in a way when you're connected to what you're doing. So we've mentioned that before here. So do people have activities where they kind of lose themselves in that way, where you feel in the flow with things? In your music, I remember. You lose yourself in your music. And anybody else lose themselves in their music? I do.
Love music.
You love
music.
Yeah. So there's a bit of that. Yeah. You play the piano. And you lose yourself in it in a good way. You feel some flow. Yes.
Losing yourself in something, we provide an art class, and you can lose yourself in painting.
An art club. Does anybody lose themselves in painting? Yes. You do, and you experience that. Yes. Tapestry. Okay, so different kind of two opposites. Tapestry and shooting. But you don't shoot the tapestry.
Watching Liverpool win.
Watching Liverpool win. Okay, so that's a conditional flow. That's conditional. If they lose, what happens to your flow? Okay, but watching a good soccer game. Okay, so relationships. I'm sorry, okay, so we've mentioned relationships, and relationships comes through a lot of what we do. So a lot of the talk. So fostering deep, meaningful, and supportive connections with other people. Does that resonate for people? So that's kind of part of what you're doing here with the whole program here. So there's been increasing research on for human beings about the importance of human connection with other people, including less heart disease. So it can go quite so that the human connection, being seen, connecting, communicating with other people, that's important. So if you think, so okay, so those are two, and then meaning. Okay, are you okay there? You're right. Okay. So serving something bigger, or a bigger purpose, finding purpose, and having a bigger picture for life. Who does that resonate for? Having kind of believing in something bigger, seeing something bigger. Yeah. So I think that's part of what goes through the Jewish religion. Also, so I think there's something bigger. And it kind of connects you to that bigger purpose and kind of humility, but a bigger picture. So that has been shown definitely to be connected with well-being in people, in many different different times or researches that's been shown.
I just want to ask you, if you try to connect with people and you're nice to them and you can't, when you do everything to them, why do they get nasty and just walk away?
So that's not so that's not a connection for you then. So you're not feeling connected, so it needs to be reciprocal. So connection is something that's reciprocal.
How do you do that?
Well, so that will come back to. So just want to go. So that's an important question. So hold that for yourself. Okay. So accomplishment. Seligman feels that this is important. So setting and achieving goals, mastering skills, and experiencing pride in accomplishment. So I think that the things that we feel accomplished by can change through life, and people can be very accomplishment orientated, maybe a bit younger, and then that changes a bit. But anyway, so these are things that he thinks are important for well-being. And so the issue is that when people are lacking these things and suffering in them in their lives, it can be, that's really a navigation to get to feel better, to manage and attend to those things. And those are some of the areas where, in more stressful situations, people can medicate. That's where medicines tend to come in, and that's not really the role. Medicine's not designed to look at these kind of wider areas of life, and so this is not just a theoretical or hypothetical thing. This happens. So then we go to the next thing. Okay, so some of the reasons. So what do we think are some of the reasons behind the increasing medicalization of kind of variants of normal life? I've got one there. So what do we think? If we think, why is it easier? Why has it become easier to medicate things that don't necessarily need medicating? One is there. So,
Related to that one,
Yeah.
advertising pressure.
Yeah.
And pressure on the doctors to prescribe.
Absolutely.
So that the pharmacy can make more money.
Yeah. So pharmaceutical pressure. So I think we are, as human beings, we are a bit susceptible to advertising. We may think that we're not, but things get under our skin. And if something is in your consciousness, a lot of the time, then it tends to stay there. And so there's a lot of pressure from pharmaceutical companies. They've got lots of money, and they big, effective advertising pushes, and so that's definitely one of the reasons behind increased prescribing. So that's one. Okay, so let's think of other reasons. Okay, so I'm going to go through them. Okay. Does this ring a bell? So this is on the side of the practitioners. Risk aversion and liability culture. So that means, as a practitioner, so I think it just is a phenomenon in Western medicine over the last generation, or maybe a bit more than a generation. I think it started a bit in the States, that people are, there's much more litigation that goes on. There's much more worry about missing stuff, and there's that complaints culture, litigation culture, lawyers involved, and so hence the clinicians or the doctors are more averse at thinking laterally. They're more reticent to think laterally, and they want to be sure of pinning a diagnosis and having a treatment that is an accepted line of treatment. So that makes sense, to avoid the perceived risk of possible litigation. So that's in the mix. So these are all swirling around in the mix. So definitely, I've experienced that. Most doctors have experienced that. It is a trend in healthcare, and it makes people think more down a certain line. So cultural intolerance of normal states. So things like, so there are things like grief, if somebody has lost somebody, and all of that process, or if somebody's experiencing like a change in life, say the menopause and with symptoms associated with that, or if somebody's experiencing, say, loneliness, which is kind of a state of life, there can be certain cultures can be more uneasy about just sitting with some distress in that, some knowing that, some awareness that there's not necessarily a quick solution, but there is a solution, but it's not a quick solution. And then there can be a push to think, oh yeah, well, medication's going to help, like antidepressants, that kind of thing. And there can be a push to that. Well, that's not necessarily a holistic answer. So that's another area. Okay, so I think it's a bit of a trend. So you get mission creep of diagnostic criteria. So some areas which would have been part of normal life before now have a diagnosis to them, a medical diagnosis, and then you can have medication put that way. So that's a whole area, particularly say in mental health. There can be crossovers in that way. Okay, so I think this has been, so people tend to listen and bow to medical authority. It's not always the greatest wisdom. Sometimes it is, but sometimes it isn't. And so people tend to take, what is said by the doctor, and when medicine defines a problem as pathological, it shapes social norms. So there can be some of that. And technological capabilities. So we never have less technology than we had. It's always, you always build on the previous technology, and if something can be measured, it often can become medicalized. So that's an issue. So, for example, they've done like whole body scans on people just to see if anything is there when people don't have symptoms, and then often they'll find tumors or something, but they don't know what to do with the tumors. And they won't necessarily have any adverse effects on life, but it gives a conundrum, gives a difficult situation. So things can become medicalized if they're measured. So that could change the. And social problems may be reframed as medical problems. Okay, so what do people think about that? Does that resonate? Does it make some sense? Any questions about that? Or does it make sense? Okay, so it is part of what's been what's in the background. Okay, so what I thought we would do now, so because this is, we want to be interactive, we want you to have an opportunity to think through things, discuss things, ask things. We've got some cases, I've prepared some cases, and these are nice, solid grey area cases. And so I want you to get together and think about what is going on. So I'm just gonna, okay, so we're gonna skip over that. Okay, this is the case, okay. Right, but these pictures in the way. Let's move this to here. Oops. How do I move that? Okay, we'll just move to there for now. Okay. Oh, sorry. Okay. Okay. Right, this is the first case. So, for those physically present here, I'm going to hand out this case, and if we can split into, I think, 4 groups. I've got 4 of these, so maybe 7 people in a group. So if you go together, I'll hand out the case, but this is the case. So Mr. D, so he's not himself since his wife died. He lost his wife for 50 years, 8 months ago. He sleeps badly, has little appetite, and says life feels flat. Okay, so his daughter asked the GP, isn't it time he went on antidepressants? So this is a real case. Okay, so for those of you online, I suggest if you just have a think. So we're going to take about 10 to 15 minutes to discuss this case in groups, and then we'll come back to the main group. For those of you online, if you just have a think about this case and see what comes into your mind about that, what your consideration about it is. And for those of you on YouTube, you may want to wind forwards about 15 minutes because it's going to be silent otherwise. Okay, so if we can get into groups of about 7 or 8, and I'm going to hand this around. Okay, so maybe. Okay, so maybe if you guys, so that's the case. Maybe if you guys get discussed it. Okay, I've got more. So yeah. Okay, so have a think about what's going on. Okay, so I'm going to give this one here. I'm going to give this. So have a think about what's going on. Have a think about that. What's going on? What's he need? Does he need antidepressants? Okay, so I'm going to go. I'm going to hand one here. So. No, I think. No. So we don't check what you think. What you think about it. Maybe have to think about what's going on. Have to think about what's going to be helpful. Have to think about and just have an opportunity to think about your thoughts, come out and see what maybe helps him, including whether he needs antidepressants. So I've got a. Okay, so I'm going to give one here. Okay, so maybe you can so if you can put it together and have a think about what's going on. Maybe you guys want to Okay, so we're coming back into the plenary now, into the main group, and we'll have an opportunity to hear from people. And to hear your thoughts and your learnings and your wisdom. Yeah, you can speak to the, well, when they're back, then let the group know, absolutely. And your name is? Jenny. Okay, want to hear? These conversations could have gone on for quite a lot longer, maybe another 15, 30 minutes. There was a lot of conversation, a lot of activity in the groups. And so now we have an opportunity to pool our knowledge, to hear your thoughts, hear your kind of learnings, wisdom, all of that stuff. So, okay, so we're coming back into the group, and then we'll hear from people. Got an opportunity to hear from people. So, what did you come up with? So would love to hear from people. Yeah. Tell me your name. Ellen. Yeah.
Okay. Take an antidepressant pill, one suggestion. Find a girlfriend. Get a caregiver, and make sure he has a caregiver. He needs professional help. Get out and meet people. Get a social life. Bring friends to his house. And then I thought this is a brilliant way. Meals on wheels. People can bring him food and have a chat with him. And my brilliant way was join the whiskey club. That's ours.
Okay, so that's quite diverse. So your group, so I think the people who are on Zoom won't be able to hear that. But so it's like they had a game called the Generation Game, where you had to remember what was on the conveyor belt, which has just gone past. I need to remember what you said. So, join a whiskey club. So tell me one or two of the others. Meals on Wheels. Get a social life. Okay. Bring friends to his house.
Find a girlfriend.
Find a girl. Okay. Okay. So these are quite different. There are some themes so what are themes that go, or what's a theme that goes through those answers? So these were from different people. So you got some people saying, Meals on Wheels, social life, girlfriend type situation. Then you've got another person saying antidepressants. But what's the theme? Joining the make social contact. That sounded like that was a theme that was going through the group. So make social contact. Okay, thank you for that. Okay, so other people, what came up for you? What were your thoughts? So, Jenny, you had some...
Okay, I've got 3 children now. One son lives in Israel.
Yeah.
I've got 3 children, and he got divorced.
Yeah.
And then my other daughter lives in Cape Town. Went through a very, very bad time.
Yeah.
And we got phone calls, and father was dying. I had to fly from both to come to South Africa, or he passed away in December. My children are not coping at all. So what I do, they're there, but I am going to Israel in April.
Okay, so that's...
I've never seen my grandchildren.
Okay, so that... Okay.
The other 2 were from South Africa.
Okay.
So, I phone her every day. She's been through a lot. She's been a really rough, and then I had a car accident. I've got no car.
Okay, so that's a...
So thank God, yes.
Yeah.
But people aren't amicable.
Okay, so it's a difficult situation. Yeah.
I am managing.
Okay.
But you know what you can put on a group? Could somebody please help me? I need to go somewhere. And you know what? get no response.
Okay, so that's good. Okay, so that's
So
different.
people
Okay,
ask
thank.
what you think they are.
Okay,
in
so
South
thank.
Africa.
Okay, thank you.
And I was the one that did everything, that does everything. And you know what? Life is life, and you just got to accept it. It is what it is. I got out a lot. I've got lots of wonderful friends. My family are here, a lot overseas, but my children are not concerned with me.
Okay, thank you for that. Thank you for that. What did other people come up with in the discussion about their cases?
And what did you come up with?
I know there was a lot of conversation. There's a lot of conversation going on here. There was a lot of conversation going on in that table. So what are some?
On them one by one. And
First, you need to put yourself out. Go back to school, come to the
So okay, so you're thinking meeting people, meeting people. Can we just focus and listen, because there are a few conversations going on. It's a bit difficult to listen to the. Okay, so Anne was saying, okay, so to get out, come to Chabad, and you didn't think that antidepressants were helpful. Did anybody think that antidepressants may be helpful? Yes, so tell me more about that, because that's not necessarily. There are not definite answers. I think if you answered this one and didn't have social interaction, that would be a miss. But so we will have one. Yeah.
Why should the person suffer the rest of his life?
Okay.
You know, it can ease into, like you've got to have pain, you take the discipline.
Okay, so that's a sure. So that's a.
It helps you, and you still have to get
So taking it, yeah.
You still need a psychological help with that.
Yeah.
But,
So
but
and
you don't have to suffer.
an antidepressant can help somebody's functioning to improve to a certain level, so that they're more amenable to psychological support. Tell me your name. 𝗥𝗘𝗔𝗟. Meila.
Somebody was asking actually in our group, Joey, that if they do harm, if you take it over a long period.
Okay.
Antidepressants.
So that's a question. Do antidepressants do harm? Well, I think the greatest area of harm, in a way, that they can do is where they're given when it's not indicated for them to be given, where there are other things that are required. I think that's the greatest thing. But there are many patients who do well on antidepressants, and they've been on antidepressants for a long period of time, and they function well. So, but it's all a concern. So there are some thoughts in the room that antidepressants may be helpful. Any other themes or anything else that? So they say that antidepressants are not pharmacologically addictive, but it can be difficult for some people to come off them. So that's part of it. Okay, but other. So we've got antidepressants. Any other thoughts, general themes about this case? Yes, Brian.
Antidepressants do help with the short term, not the long term.
Antidepressants help for short term, but not long term. That can be the case, although some people are on them for a longer period of time. So how about this group over there? You had some. I was hearing some interactive, rich conversations going on.
I said, you're talking about antidepressants. Antidepressants would help, but they have to be very, very controlled. You know, by you can't just go onto antidepressants by yourself. So they have to be controlled. I know other people that have changed different types of until they get the right combination, and then they're fantastic as long as they take their medicine. You know?
Yeah, so you're talking about controlled of antidepressants. So they should be prescribed from a healthcare practitioner, and the dose should be carefully modulated. But I would say that antidepressants it's best when there's a holistic package for the person, in terms of other aspects of life, like social interaction and.
He must want to get involved himself, but if he's depressed, then he doesn't want to.
Yeah. So it's kind of degrees of depression. So if the person is depressed, do we think this man is depressed?
Yes, must be.
is he depressed enough to need antidepressants?
Otherwise, he would have come out of it a long time ago, I'm sure.
Well, okay, so that's also a consideration.
My saying is, my saying is, yeah, to my wife.
He hasn't got a wife to see you. No, I'm saying, this is why he gave the story, he hasn't got a wife.
Right, so
Yeah.
But how can this guy say yes there when she's not there?
No,
She passed away.
my wife's
okay. What's your point? I don't know.
That's a classic. He says it every day.
Okay. All right. So, yeah, Miriam. Yeah.
It sounds to me, to summarize,
Yeah.
that this guy needs intervention from a psychiatrist for medication and a psychologist for counseling.
Yeah, so that would not go amiss. So just a few things here. Okay, so we'll go. Okay, right. So this,
Really quickly, don't talk rubbish.
okay, I'll try not to. So, okay. So just in terms of some features here. So poor sleep, reduced appetite, low energy, and feeling that like life is flat are all common features of bereavement. So at 8 months, it can be common for grief to feel intense. So it may be that this guy is just going through, grief after 50 years of marriage and after such a shared life together. So that's okay. And then there were some comments about antidepressants, several comments about antidepressants, and is he depressed? And I think that okay. So I'm going to go on from this slide. So I think in terms of when you'd be concerned about him and want to support him in any case. But in terms of depression, it's degrees of symptoms. So you'd be if he's like low most of the day and is not seeing any glints of light at all, or if he's got pervasive throughout the whole day hopelessness, worthlessness, with nothing else really coming through, especially if there's some suicidal thoughts, anything like that, then that may suggest more that he's gone into depression, and so it's degrees of things, but that's. Okay, so what would be helpful for him? Absolutely, social contact, but support groups. So support groups been really helpful. Can help to, and it's just that ability of sharing with another, of speaking and sharing with another human being, because when we do that, we get to see ourselves better, and we get to be able to put things in perspective. And you can't really do that without another human being. It's kind of difficult to do that. And also things like, so not to forget gentle encouragement of routines. So those are the routines of sleeping, eating regularly, and having some exercise. Those things are all important. And also throughout that process, there would be some reminiscence and telling stories. Telling stories, as in telling the truth. I mean, not making things up. Telling stories about his. So those kind of things can be helpful. Okay, so lots of discussion on that. Okay, so what I would suggest that we do now is go to the next case, and so we'll stay in the same groups, and then we can discuss this case for 10 minutes. So I'm going to move on to the next case. So we need to go. Okay. Okay, this is Mrs. K. She's 74, and she occasionally forgets names and misplaces things. She functions well and lives independently. She says, my friend says this is how dementia starts. I want tests, okay? So if you people on Zoom have a think about this case, and the YouTubers, you can, again, because we're going to discuss this case in the group, if you like forward on about 15 minutes. Okay, so I'm going to hand... All right, everybody. So we'll come back into the group, and so I've heard from some people that these conversations could go on for another few hours at least, and that we're early days into the conversations. Yeah, that's great. It's great. Yeah. Sure. So that's the thing. Okay, well, welcome back, everybody. It's like there's a momentum, a momentum, isn't it, in the room. It's going to have its own life. Yeah. Okay, so what do we think? What came up in the groups? What's your thoughts on this one? What's your considerations? Questions? If you want to, you don't have to. You're going to go first again. Okay, this is the pioneer group. Yeah.
Everything down, because we reckon you would forget it.
So, right, just for you people online, they wrote everything down because they were worried they would forget it if they didn't.
Give her a notebook, maybe a tag around your neck with the phone number and address on it.
Okay, so a notebook. Yeah.
Maybe she needs to have more tests from doctors and that.
Well, that's a central question here. Should she have tests?
And then we said maybe
Okay.
an electronic tag to
Okay.
tell you where your gadgets are. On your phone.
Okay, so some things to help her memory and help her remember things.
Samsung have produced a tag you can put on your property.
Okay.
It's going to alert your cell phone where the things are.
Okay, so you can put a tag on your property, so it will alert you where your things are. Okay, what do people think? Should she? Would you start tests on her? Should she have tests? Be left as she is? What do we think?
What the previous people said is absolutely correct. It's a no-box system, but I don't think it would be any harm if you don't have a test.
Okay, so keep a notebook, certainly to help them memory, and those tags and those kind of things to help the memory, and then we have a thought that it would not be harmful to have tests. Are there any pitfalls of having tests or any considerations? Yeah, comment.
The things that we're talking about, I would say, are very common in this group.
Yeah, of course. Of course.
So, what kind of tests would they give us? Not to waste our time unnecessarily,
Yeah.
not to be invasive, not to include drugs. What kind of test would you give for people who've got just like basic seniors?
Yeah, she's got basic seniors.
I don't even want to put it in everybody else. We have
Yeah.
an overcrowded memory. We can't find that.
Yeah. So, but her friend wants her to have tests for dementia. So those tests for dementia would include presumably blood tests. No. I'm just saying what they are. So they would be a blood test. They would be probably a scan, a brain scan. So those are okay. So the general feeling is the group is not at this stage. Okay. Yeah, so she could have. I mean, yeah, it's common, isn't it? So not at this stage. So that, and she. But if her memory was worse, so give me a suggestion of something that would be worse in terms of memory loss. So maybe if she got lost, and she couldn't find her way home. Okay, that
Can't find her things.
she really can't find her things, and she like it all the time. Should she have tests then?
Yes.
But there's other things that you need to look at. You have conversations or you give instructions, and you have to give
Yeah.
them multiple times over many days.
Yeah.
Still not
So then there's a strategy for helping the memory. So maybe there are some times. So I think the consensus here in the room is probably towards maybe not necessarily testing at this stage. And what can they do? So exactly, that's a question if she has tests. So with the previous case, there was a greater proportion of the room who thought maybe antidepressants for the Mr. D, who'd lost his wife, could be a consideration. But here it's more towards not testing. So there are some. Okay, so what's normal aging? What would okay? So normal age-related memory loss. So we're all having elements of that. Okay, so the brain processes information more slowly and may take longer to retrieve stored memories. Common examples include occasionally forgetting names but remembering them later. Is that familiar? Yeah. So one of the things is that names are one of the things that go earliest, and that's because there are less kind of associations that we have kind of internally with a name sometimes. There are less processes for us to remember that. So misplacing items like keys or glasses. Okay, so it's degrees of stuff. So I think if you put your keys in your fridge 3 times, that's, you get, everything's on a continuum. You begin to worry. Or if you leave your house and the oven is on once, it's bad, but it's okay. But if it happens 2 or 3 times, you begin to get, everything's kind of on a continuum, and then I suppose you trust your worry antennae. Needing reminders or notes more often, that's all within normality. Sorry, then the normal aging. Taking longer to learn new information. Has anybody experienced that here? If anybody says no to that here, I'd be impressed. But it's possible. Brief. Oh no. Okay. We have 2 no. Okay. Very good. I'm going to go to your classes. Next. Briefly forgetting why you entered a room. And word finding difficulties. It's on the tip of my tongue. Okay, the thing is, in the very early stages of dementia, tests frequently change less than people expect in any case. So it can be a consideration. Some people like to know what the diagnosis is, so you could get some diagnostic clarity. But possibly, but early on, tests are often, this is where we get the ambiguities, borderline, non-specific and uncertain. So we want to be definitive about things in medicine, but we can't be here. Yeah.
2 comments. I read a few months ago that we've got Alzheimer's, we've got dementia, and current research is producing information that Alzheimer's might be a variation on diabetes. I don't know if you've read that.
Well, with metabolic associations, yeah.
And secondly, what is Lewy body?
Dementia. I don't know a huge amount about it, but it is a form of dementia. So there is Lewy body dementia. Okay, it's where you get a certain structure in the brain scanned, and you get little holes and little, yeah. Okay, so diagnostic clarity sometimes may be, some people may like to have a diagnosis. However, and so maybe for services like support services, maybe occupational therapy, memory clinic follow-up, that kind of thing, maybe. However, and if you do tests early on, there may be some other things going on, like deficiencies in the blood that may give symptoms of forgetfulness. So maybe that would be a reason to do at least consider doing some basic tests. So you can have things like thyroid disease or vitamin B12 deficiency, which can mimic symptoms. So maybe that would be something to consider. Yeah, Miriam.
Current research shows that the research was working on peripheral neuropathy, translated, and nerve issues related to your body, and they suggest you take the vitamin B.
Yeah.
Okay? So the brain is made up of neurons, so it's perfectly logical that if you need vitamin B for your nerves in your body, you need them also.
Yeah. So vitamin B vitamins are very important.
Doctor, what's B12?
B12 is a vitamin in the blood, so it can be tested in a blood test.
Sorry, my thing is that the most important thing is people. Is to meet people, to talk to people.
Yeah, it's important.
Involved in people, whatever you do for people.
Yeah, people are important, but but there may be something going on for this person. So we still need to make a decision. We still need to make a judgment about how much we want to investigate and think it through. So this is a situation to kind of to think through. And so one of the things, right? So.
Before you move on, just for people who don't know, anything that is yeast-based, anything that's got yeast in it, including 𝗥𝗘𝗔𝗟 here, is a very rich source of vitamin B.
So yeast is a strong sort of good source of vitamin B. Okay, so right. So if you diagnose a dementia early, pharmacological, there are some drugs that are used, but they have modest benefits at best. And medication may offer temporary small symptom benefit, delay decline by months, but not years. So, and no current treatment alters the underlying disease direction or trajectory in a dramatic way. So that's all a consideration. So these are okay. Some people may like to have may feel more secure in themselves. This is an important point. Having a diagnosis, whereas other people may make them feel more anxious, and it may shift their identity from being a person to a patient. And I've got this diagnosis, and then make them more worried. So it's always about the individual, and in the individual discernment and assessment, and seeing what's going to be best for the individual. So you can't get away with any of this without having a conversation with and understanding more about the patient in front of you. I mean, so it goes. It's just. So what would be wrong in this situation is to just go straight ahead and do tests, like have a default. Just going to do tests, because it can cause more consternation for the person than not doing tests. But for some people, it may be a thing to do. It's possibly going to be more the minority of people at this early stage of dementia, but it always requires a conversation.
With your permission, to plug Chabad Longevity Club.
Yeah, Chabad Longevity Club.
We have lots of activities. We don't just do a shiur, and at least 50% of our activities are geared towards improving mental and manual dexterity.
Yeah.
Come and join us.
Yeah, so at least 50% of the activity is geared towards improving mental and manual dexterity. So that's really helpful. Okay, so that's
Between this age and that age, you're more likely to get Alzheimer's than another age.
Well, I think it's generally as you get older, you're. Am I wrong?
There are young people that are at 7.
Yeah. So young people.
They've got dementia.
No. So no, I didn't say. Excuse me. I did not say exclusively. Okay. So I said that as you get older, you're more. You're probably more prone to getting dementia, but Alzheimer's can happen in a slightly younger population than vascular dementia. But I think generally the older you get, and that doesn't mean to say when you get older you're going to get dementia by any means. It's just that the incidence is slightly high.
President Reagan also got Alzheimer's.
Yeah, I think he got Alzheimer's. So that's this case. Would you like another case? Where are we? No. Would we like another case? So I'm going over. So when is lunch? Are you having lunch at 12? Is it ready? Because somebody want to see if it's. Could you just see when? Okay, so I'm going to go on to the next case. Okay, so Arthur is 84 and he fell once last year. It was not a nice fall, but he fell once last year. Since then, he rarely leaves his home and avoids stairs. Physically, when you see him, he's kind of steady. And his children suggest physiotherapy and possibly medication for anxiety. But the question here, or a core question, is this rational caution? Is it reasonable what he's doing, staying at home, avoiding falling again? Is it ready? Okay.
Just give us a conclusion.
I'll give you a conclusion. Or is this anxiety disorder? Okay, so generally in this case, you'd want to spend time with him. You want to talk to him. You want to see the circumstance. You want to have more of a narrative of what went on. You want to see the circumstances of the fall. It may be that he tripped over something and he hasn't tripped over it since, and it's all repaired. You want to. So definitely he wants to have some more confidence. So physiotherapy would be definitely a good idea. And you'd want to talk to him and have an idea about whether he's depressed. You also want to see maybe he's got some underlying conditions like something that's going to make him unsteady, but that says he's walking steady, but maybe he's got thin bones or something, so you want to be a little more cautious. But generally the waiting here is that he's gone into some anxiety situation. He's being hypervigilant, he's being overly cautious, and actually by not getting out and by not moving around, you decondition yourself. So this is working against him. So I think you want to work generally with him. And so this leads us in. So we're going to do a session. I'm going to do a session in 2 weeks' time on risk, perception of risk and uncertainty, and where we maybe get fearful around it, because we are not very good as human beings about estimating risk. We overestimate it, or sometimes we underestimate it. And so it's just not one of our faculties that we do so well, and it does have a significant effect on quality of our life sometimes. So he needs gentle support really, and you want to see in a few months' time, hopefully he's able to go outside in a safe place. And you definitely don't want to start him on marathons straight off. You want to work up towards marathons for him, very, very gently. No, so you want to work up just bit by bit. But yeah, so that's the general thrust of this one.
That's the next thing that most people don't know about, which is crucial in this case.
Yeah.
In your ear, you've got something called semicircular canals.
Yeah, you have semicircular canals in your ears. Did you know that? It's a part of the ear. Yeah.
And there are little crystals in these canals.
Yeah.
And sometimes, especially when you get older,
Yeah.
the crystals fall out of place. And that can cause you to to feel, and I know personal experience,
Yeah.
it can cause you to feel very dizzy,
Yeah.
or even fall. The good news is, the treatment is very basic and very simple. Go to an audiologist, he'll do some movements
Yeah.
with your head, and get those crystals to go back in place, and Arthur will not fall again.
So that's one of the commonest causes of dizziness. I mean, it could be that he fell due to another reason.
Yes.
It could be, but that's a common.
But I want people here to know
Yeah,
that
yeah.
this condition exists.
It's the most common, one of the most
The
common.
diagnosis for this condition is you often feel dizzy with it.
You feel dizzy with it, yeah. Okay, so we're on lunchtime, so thank you very much, everybody. How was this session? Was it interesting? Do you like it? Did it make you think? But also, we're really looking. Has it clarified any things for you, like in the future? Are there questions that you would ask? Are there? Okay. We didn't quite get an answer to that. So are there? Has it? Just want to mute.